Hello, I am Dr. Teresa Owens Tyson. I am a family nurse practitioner, CEO, and president of the Health Wagon. And this is Dr. Paula Hill Collins. She's actually taking care of a patient right now, as always. And so she's also a family nurse practitioner, clinical director of the Health Wagon, and vice president. And we're here to tell you about our Move Mountains Medical Mission, our M7. And this is with the James H. Quillen College of Dishner, the third year medical students. And we have been doing this event for 36 years. It has been phenomenal every year that we have.
Yes, and we're just so amazed because Dr. Culp, it will actually be, and you all know Dr. Culp, you have to have known him by now. He actually said he came to the very first one, and ETSU, the sustainability of doing this rural health since 1989. So he has been here and he's returning for his 36th year, and so is ETSU. And this just tells you how phenomenal this event has been every year and how it's grown. We usually see 250 to 300 patients within 2 days, and it's because of all of the just conglomerate of everything that we offer, including echocardiograms, ultrasounds. We're going to be making hearing aids on spot. We are EKGs, cardiovascular disease screenings. We're going to have the ETSU first year as third year medical students here, third year medical students here with Dr. Culp. Dr. Flores usually comes, and just the absolute phenomenal and brilliant physicians that we're lucky to have here. And for the ultrasounds and echoes, you do need to be scheduled. Everything else is walk in, first come, first serve. In addition, thanks to Feeding Southwest Virginia, we're going to have 100 food boxes each day. And as the economy and the stock market continues to plummet, I think more of us are having that food insecurity. So tell your neighbors, come out and see us. Come out and get you a food box. We're going to have other giveaways that day, and come out and see us. Come and see Teresa and myself. We're going to have mammograms that are going to be available that Friday. And as I said, we've just got everything. Teresa, what have I missed? X-rays.
The best way is to go to our Facebook page, because we do have a detailed listing on our Facebook page, the Health Wagon, and just look it up. There is a detailed listing. We have so many services. We have Dr. Smitty. He's a pulmonologist, and he's our medical director here. He is coming over to do chest x-rays. Everybody loves Dr. Smitty. He'll do things such as a pulmonary function test, and those for that smoke. He can help you get off smoking cigarettes, because that is, as everybody knows, one of the worst things that you can do for your health. So he is here to do x-rays. Free
and he's our
lab
Appalachian
work.
hero, who y'all haven't heard about that. We chose him as our Appalachian hero because Dr. Smitty and his family have been here in this area since the 1950s, including Papa Joe Smitty. And there is no other Appalachian hero more deserving than Dr. Joseph Smitty. So that we've given him, it was a Health Wagon Award, because when you're out in Damascus and we're out in the field, and Teresa and I are going door to door, and all of a sudden you see a pulmonologist, a renowned pulmonologist, show up in the back of a pickup truck with a portable x-ray machine and start x-raying people. That's an Appalachian hero. He doesn't wait for the government to come. If he did, he'd have still been waiting over there. He stepped in, he did it himself, and he showed us how to pave the way, and that's what we keep doing.
But we have free lab work, ultrasound. So I know a lot of people are using the medications, the GLP-1s, for weight loss, and you really need a thyroid ultrasound, is what Paul and I tell our patients. Any of our patients that we actually use the medication for, is get that thyroid ultrasound. And actually, I ended up, health fair saved my life. We were out at our RAM clinic many years ago, and I went over for a thyroid ultrasound, and I ended up with thyroid cancer, but I caught it early. So
and she was totally asymptomatic. She went with me because I said, Teresa, I think I may have had nodules. Will you go? I have to have one done. You come and go ahead and get yours screened. Well, mine was fine, and she had thyroid cancer, not one symptom, not one sign, and was found it on ultrasound.
And that is the whole thing, is catching things earlier. And I think a lot of individuals here in our area, we hear it all the time. I don't want to know. I just would rather not know. No, knowledge is power, and you want to know. If I had not have found that, I mean, God knows what would have happened. I mean, you don't want to die at an early age when you do not have to. And so the things that we offer during these health fairs is a lot of cancer screenings, a lot of prevention. If you've got a chronic disease, and even if you've got maybe another healthcare provider out there, maybe you want a second opinion on something, or you think that you need a particular test, come and discuss that with us. Like these third-year medical students, they're absolutely brilliant. They are some of the top in the nation, and they will do wonderful exam with you. They will get your detailed history. They will check you out, and then they present that to like Dr. Culp or Dr. Florence or others that may come with them, and you get some of the best care that you will ever receive. I mean, I try to get friends and neighbors and family in at these events because it's just so worthwhile.
And it's free. It is totally free. We do not ask for your insurance. This is totally free. This is for the community. As I said, it's been going on for 36 years, beginning with our beloved Sister Bernie and Dr. Culp. And when you were talking about Dr. Culp and Dr. Joseph Smitty, you're talking about years of experience, and you're talking about knowing what they're doing. And I would put both of their knowledge up against anybody in the United States. They are top of the line, and we're so thankful and so blessed that they have decided to make the Health Wagon part of their home.
Yes, and so come out, join us. We have a lot of freebies, a lot of fun. We always do a strong women's health focus, doing pap smears. We will have Ballad Mammography, our good friends over at Ballad, with us on Friday doing mammograms for us. Women, come out and get your bone density. Know whether you've got osteoporosis. We can do things early on to prevent like the disease progression that we have. These are not just little health fairs where you come out and get your blood pressure checked, your pulse checked. No, these are like health fairs on steroids.
Yeah, and we'll have x-rays of everything. It isn't just chest x-rays. We will have, we actually have Rad 8 International here, and they are sending ultrasonographers. They're also sending x-ray techs. If you have been having neck pain, come in and get your cervical spine x-rayed. Come and get your back x-rayed. If you think you've got a broken foot, come and have it x-rayed. Again, take advantage of these services. It's one time a year. We get back in touch with you with your results. From the beginning, we are not going to ever do a test and then say, see ya. We're going to get a hold of you. We're going to tell you the results of that test, and then we're going to offer you follow-up with specialists if it's over telehealth. If it's specialty clinics here, we are going to be taking care of you. Dr. Smitty has a special focus in asthma, and this year we're even focusing on pediatric asthma.
And then on Thursday here at the Owens Hill Dental Clinic, we will have dental services as well. So come out and take advantage of those dental services. Again, go to our Facebook page, like it, invite your friends to like the Facebook page because we offer so many services year round, so many projects that are going on, and you may save somebody's life just by putting it on your Facebook page, liking it, sharing it, and so forth like that. So everybody we'll all work together to make our community a healthier place to live.
Thank you. Come and see us.
Hello, I am Dr. Teresa Owens Tyson. I'm family nurse practitioner, CEO and president of the Health Wagon. And we have with us today Dr. Jennifer Hammond. She is a PharmD, and Dr. Paula Hill Collins. She's also a family nurse practitioner. She's vice president and clinical director here at the Health Wagon. And we are here to tell you about the wonderful pharmacy services at our newly opened St. Mary's Faith Pharmacy.
And this is something we're so proud of because our roots go back to the St. Mary's Hospital and to that Catholic base that my baby was born at St. Mary's. I know most of you all are, and it was at the root of our community for so long. So Jen has been with us, and we say she was a homegrown pharmacist. She's been with us from the beginning because dear Sister Bernie and Sister Jean actually took her under her wing. And Sister Jean was Jennifer's godmother. And Jennifer is Catholic, and we actually have the rosary that was placed around Sister Jean, don't we, from Rome, when she was ordained, I guess, in the order.
Yes, ma'am.
So, and we've got all the pictures of the nuns up here. So if y'all haven't been here, you just need to come because back in November, we actually had an appreciation day, and I think we had Pentecostal here, we had Catholic here, we had Baptist here, and they all said prayers and blessings over our clinic. And
needless to say, we had church service
we
that
did.
day.
We did. Yes,
it was
we
beautiful.
did.
But Jennifer, tell them how you got kind of started on your road to path to become a pharmacist.
Sister Jean took me and actually told me that I was too smart and needed to do something to help people. It's a true story. And so Sister Bernie was on the board of directors at the pharmacy school. And that's how I got interested in pharmacy. And then Paula and Teresa took me to pharmacy school and told Mickey McLaughlin himself that he had to put me in pharmacy school, that we were going to open the area's first free pharmacy. And so here we are, I think 12, 13 years later with the first area's free pharmacy.
Yes, yes. And how many millions have you did so far?
We've done right around $1.4 million since July 1st in some capacity of free medicine to our people.
Yeah. So one of the objectives is really not how much medicine we can dispense, which Jennifer dispenses a lot of medications there, but is to help individuals, achieve healthy lifestyles through diet, exercise, and optimal management of their chronic disease processes.
And food is medicine.
Yes, food is medicine, and she wants to get people off of medications.
We focus on deep prescribing is really important to us. So we take your medication profile and see if you're on 2 or 3 things that might be doing the same thing. We try to take you off of those, because the less medicine you're on, the better off you're going to feel. All the time.
Yeah, because you need what would optimally control that disease process.
For sure, yeah. Really, so it's important to know, which medicine is working best for your disease state.
Yeah. And she doesn't even just do the medication management treatment, but she looks at the whole person,
Absolutely.
the holistic person, and she looks at medicines that they've been prescribed, maybe not by us, but other people, and they can't afford them. So she will give us suggestions on, okay, this may not work, I can help get this free for them. Especially we have a lot of our older patients who I say, if our country has failed anybody, they have failed our elderly.
For sure.
And they are the ones that are in the donut hole. They are the ones we have the most difficulty trying to help get their medication. And Heather Mays, who is our pharmacy assistant, and she just actually passed her pharmacy test.
Did. Yeah, we're so proud
just
of her.
like this week. So she and Jennifer work to try to get medicines through the Pharmacy Connect. We try to have vouchers that we give out to Medicaid for patients. But our pharmacy that she runs, the St. Mary's Faith Pharmacy, is just for the uninsured. We try to take care of everyone, but the medications are given to us free of charge, so they can only go to the uninsured.
Right. The pharmacy itself is just for uninsured, but another important call out that our providers use for people with insurance is that we're able to make recommendations of medications that are approved by their insurance, medications that are more, cost effective, or actually just therapeutically work better because we have a pharmacist on staff, and we can kind of look at medicine a little bit different than other clinics.
And different than hospitals, because one of the things that we have a lot of nursing students that come through here. We have physician's assistants, nurse practitioners, residents, physicians, and one of the things we tell them is when you're prescribing something, it does not do a bit of good to give someone a prescription for $500.
Absolutely.
Because to people here, that's car payment. Okay, they can't prescribe that. So the likelihood that they're going to get it filled and to be able to keep filling it is very unlikely.
Right.
And a lot of the copays are that much now.
They are.
A lot of the insurances, if you have a $3,000 deductible, you will not meet that deductible till you meet that prescription deductible also. So right off the, right there, you've got $3,000 worth of medication you have to fill. So that's where our pharmacy, we look at it holistic, comprehensive, and that's what we have here at the Health Wagon is an integrated, comprehensive, collaborative care model.
Yes.
And that's where we try to take dental, mental health, medical, vision,
head to toe,
hearing. Yeah, we try to do head to toe, but we've got 7 missions, and one of them, of course, is pastoral support and faith, and that's our pharmacy. And then we have the social aspects in which we try to help you with food boxes. We try to help you with groceries. We have people calling us all the time for formula, for needing help for clothes for their children, and we try to look at everything.
And with the model that Paula is talking about, that is a model that we feel that we have developed because it is so comprehensive in the care. We don't think there's anything really like it out there that we found because we are so comprehensive. Paula mentioned all the valuable services that we have, and we try to use a spoke and hub model. We're out there with the mobile health units. We're reaching people out there in their communities, and then if need be, if they need to come back into the clinic, say for an ultrasound or an echocardiogram or something of that nature, then we get them back in here. So we're using a hub and spoke, but it's a very comprehensive model that we were really very been blessed to
There's
have.
nothing
And
like it.
we couldn't have done it with all the networking partners that we utilize, and covering everything from to hearing to vision to dental to behavioral health to the acute and chronic disease management. I mean the whole gamut. There's a lot of healthcare services that are offered here at the Health Wagon.
Disaster relief.
Yeah.
Yes, we've been very involved in disaster relief. Yes, very
boots and
much.
backpacks is what you
Yes.
all do.
And using innovative strategies to our advantage. With using satellite technology, we deployed 50 of those in Dickinson County and 50 in Wise County. Satellites so that people could be connected back to our Title Health, our health monitor here, and so we could do optimal telehealth services with patients. Is just one of the things that we have did lately. So we're always looking, at that innovation and being able to bring the innovation back. But I know one of your specialties that really hits home with a lot of people. There's a lot of diabetics in our area.
Yes.
So you have that focus with diabetes that you can really help people with.
Absolutely, yeah. So most of our patients, around 80%, have diabetes in some form, whether it be type 1 or type 2. And so medication access and education is huge with our population base here. And so if you look at, I think company-wide, our A1C is 7?
Yeah,
Which is below national average. And that's because the care that we do provide here, medication access, just access to have better health care here at the Health Wagon is really amazing what we get to do here.
Yeah, because even like you can take like our diabetics for example, like Jennifer's saying. I mean, there's no way we should have such good control of our diabetics with all the issues that our patients face. But when we remove those barriers, when we take the care out into the communities, when we get them to specialty care, we can arrange for endocrinology care, which is the specialty aspect of diabetes. We can arrange, getting their glucose monitors for them. Sometimes we can even get the continuous glucose monitors. We can get them their medications, which is a huge component of that. If they're on insulins, we can get that. We can help patients so that they can take care of themselves. And so when you remove all those barriers, give them the education that they need to take care of themselves. It's not that people do not want to take care of themselves. They just don't always have the resources, and that's what the Health Wagon is here for. We want to give those resources to the patients so that they can live their most healthy life possible. And I think that is what the Health Wagon is. I think we give hope.
Absolutely.
And so we would love for you to come out, talk to Jennifer, anytime. I mean, stop by the pharmacy here. She's there to help you with any needs that you might have. We've also had the Pharmacy Connect, where we have provided over $25 million in free care through the years, and that's linking patients with the indigent patient programs through the pharmaceutical companies, because there is supports there. And this the pharmacy really kind of grew. The stationary pharmacy here in Mines grew out of that concept of the Pharmacy Connect that we've been involved in for so long, connecting patients with access to their medications, because there is resources out there. It's just kind of linking them up with the patient, to the support system that's out there. So that's what the Health Wagon is all about. We'd love for you to come out, talk to Jennifer, talk to us, see our providers here, especially if you do not have insurance, please come out. We can even help with Medicaid enrollment if you need that. We offer like concierge Medicaid enrollment. You usually know by the time that you walk out or that day whether you can get Medicaid, because we had expanded it here in the state of Virginia.
Yeah, and absolutely, do not forget, if y'all have not been able to visit, even if you want to come for a tour during the Thursday and Friday, we're going to give tours of the Owens and Hill Dental Clinic. It is a state-of-the-art dental clinic. We have excellent hygienists. We have Dr. Tran, the dentist that's there now. We had Dr. Olivia Stallard for a long time, and she still helps us. But we have Dr. Tran, we have Caitlin Stanley, and we have Brandy McKinney Light, and they are all local. So you all come and see us, and come and see that dental clinic if you haven't seen it. We try to get everyone that we can in. Unfortunately, we've got a dental desert here, but these girls do an excellent job with fitting you in, and that's the main thing, is that we are trying to fill a void here, and all of our services are free of charge.
And we just we want to always acknowledge God in all this, because there's no way that this is just from one person. I mean, this is it's just amazing to see how the Health Wagon has evolved over from the years, because I started out on the back of Sister Bernie's porch. I've been here for 32 years, and we see God's hand upon this clinic every day here, and how that He just helps us to be the hands and feet of Christ. And so we just come out and see us. We would love to see you. And, you're not in this alone. If you're struggling with a health issue, come and see us and we will help you. And Jennifer will certainly help you with the pharmaceutical aspect. Hello, I am Dr. Teresa Owens Tyson. I am family nurse practitioner here at the Health Wagon. I'm also CEO and president of the Health Wagon. And I have Dr. Paula Hill Collins. She is vice president and clinical director of the Health Wagon. So, Paula, you want to introduce these two wonderful ladies?
Yes, I will. And thank you so much again for having us. And for what we want to really showcase is our amazing dental hygienist. We are blessed to have, I think, two of the best.
Yes.
And they are great with children. This is Caitlin Stanley. Caitlin is from Clintwood. And we've got Brandy McKinney Light. And Brandy, everybody knows your uncle because
I know. Everybody knows all my family. That can be good and bad.
Yes, it will. So, but actually, he helped recruit Brandy, I think, for us. So we're so glad to have Brandy. And Brandy's going to tell you and Caitlin a little bit about what all we offer over there. And I told them, girl, the clinic, it is one of the most beautiful clinics. I just think we're so blessed.
Yes, absolutely. It is beautiful.
What are some of the services that we offer over at the clinic?
We do anywhere from x-rays to fillings, sealants, cleanings, crowns, extractions, root canals. We really do it all. Most everything.
And we've got state-of-the-art equipment. We have the ability to 3D print dentures as well, and we've got like the CERAC machine is like state-of-the-art that will do like a crown like in a couple of hours, as opposed to putting all that in your mouth and waiting hours, and that's we don't do that here. So it's a absolutely awesome clinic, state-of-the-art clinic. They say actually I've heard them say that it's probably one of the top in the nation, and we're blessed to have that here in Southwest Virginia. We thank God for it every day.
And Brandy and Caitlin both are very good at teaching oral health and oral hygiene, because your oral health and your dental health has been linked to other chronic diseases such as heart disease, and these girls do a phenomenal job. And even when you have a cleaning from one of these, you're going to know your teeth have been cleaned. They are absolutely excellent. And Dr. Tran is a perfectionist, so that just adds to it, because he signs off and checks every patient, and he is so impressed with both of them. But you all want to tell them a little bit about a dental hygienist too.
Dental hygiene. A lot of people think we just clean teeth.
But you don't. That's just the stem of the surface.
That's something we got from years ago. But actually, we are the ones that help fight bacteria that help decrease the risk of heart disease, diabetes, and even some certain types of cancer. Can be just brought out from infection in the mouth. So we do more than just clean teeth.
One of the most important things that we do is the oral cancer screening, and it is a little like a little instrument, and we can look at the oral mucosa, and we can just detect like subtle changes in the tissue that would alert us to oral cancer. I know that we have unfortunately, a lot of smokers in the area, a lot of people that dip or chew. Please come and get that test done. That is, we do it in conjunction with also a mouth exam, where we just put on the gloves and we feel like the lymph nodes and the tissue in the mouth as well. But it's kind of like a two-step process. But that test doesn't take probably a minute to scan the tissue, and then to get that oral exam, it can save a life as well. Unfortunately, these vents that we have, when we have these, we will pick up sometimes an oral cancer, or maybe 2 or 3 sometimes. I've seen about 3 at one of our events one time. So, again, if we catch those things early, we can do something about it. But it's when you let those things linger, so if you've got any places in the mouth that you're concerned about, particularly white patches, come and let us look at that for you. We are here for you, and we're all about saving lives.
And Caitlin, what about, if you will tell them too, about the importance of how you all actually save teeth before the dentist ever sees them? Because that's one thing Dr. Hollyfield, he's our oral surgeon, was actually pointing out to me about, what a good job these girls do. And when you're not getting that thorough cleaning, he had an aunt that lost her teeth. Even though she went first. So tell them about the importance of that and the difference in getting your teeth cleaned.
Yeah, so what we do is when you first see us, we measure your bone level. So what we do is we take a probe that goes between your tooth and your gum, and it measures where your bone level is, and that goes to show us what is going on in your mouth, whether you have active, bone loss going on, you have a disease, periodontal disease, and so we try to stop it in its tracks. We can't get the bone back, but we clean it off so that the gum can heal back up and the bone does not keep going away. So if you do not come see us for cleanings every 6 months, you are at risk of losing your teeth. Because, it can happen. How fast have we seen it happen? Like, somebody can come in and, really quick if you don't get that tartar and build up off of there. And that's how people lose their teeth. They cannot have one cavity in their mouth and have periodontal disease. And then they don't understand why they're losing their teeth. And that's because you have to come in and see one of us or a hygienist to get that plaque buildup off of there.
And I think one of the most important things is to stress, although, people think, okay, well, if I lose my teeth, I can get dentures. Nothing is never as good as what God gave you, because dentures, you'll always continue to see issues with people with dentures, because, the structures in the mouth, they change, they evolve over time, you lose weight, gain weight, things like that affects all this in the mouth, and so those are never going to be as good as what your teeth are. So that's the reason it's so important. Unfortunately, we're seeing, this is going to shock a lot of people, 12-year-olds that need dentures. It is that severe of cases sometimes that we see, and that's what we want to do so much for our children, because that just breaks your heart when you see a child, going into the prime of their life, and them to be faced with the rest of their lifetime with dentures, and having them remade and refitted, and they're never good as what you have in your mouth. So take care of what you have, and these ladies can help you take care of that.
For sure.
Paul, you got anything else that you want to add?
I think, you all do with pediatrics. We take pediatrics too, right? Because we get that question all the time. And what is the youngest that you and Dr. Tran will see? Is there a young?
Usually if they have a tooth.
Okay. Oh wow. All right, girls. Y'all heard that. So we're good to go. Thankful. I'm so thankful for these two. So that is awesome.
Yeah, and if you've got like a newborn about the age of 2 is when you do want them to get going and established and coming to the dentist on a regular basis. So. Yeah. Yes, that's very, very important. But we just thank you for tuning in and getting to meet our hygienists here. They're absolutely phenomenal. And call us at the Owens Hill Dental Clinic. We would love to hear from you, love to see you. So we're here all about to take care of your oral health with you, to help you do that.